Now, you remember a few lectures ago, I discussed the differences between acute and chronic. And I said somewhere in between is the subacute. And our difference between acute, subacute, chronic is time frame. Acute, hours to a day or so at most, from the beginning of symptoms to the onset of symptoms to full-blown disease. Subacute, going to be measured in how many days. Chronic, days to a week or weeks. Well, the subacute, a great example of this is going to be an encephalitis caused by Toxoplasma gondii. Okay. We also see that the subacute encephalitis, you're also going to see reoccurrence of measles, prions, and we'll talk about those in the next couple of lectures. But first, we're going to talk Toxoplasma. Okay, this one is going to be an issue for two patients or two groups. First group, developing fetuses. Okay, we talked Toxoplasma gondii once before, and we talked about how this one gets into a mom and is able to cross the placenta and get into the developing fetus. Gets into the tissues and it's teterogenic. It will interfere with fetal development of tissues. The severity will be determined upon which point in gestation the infection occurs. The earlier in gestation, first trimester, second trimester, the greater the effect will be on fetal development. It's going to be a ripple effect. If the infection occurs during third trimester, the baby, for all intents and purposes, is already formed. Yes, there are still some systems that are in the process of final development. The baby has lungs, but the lungs haven't completely, formed yet. Central nervous system, not quite there yet. It's process of being developed. But you go back second trimester, the lungs aren't even there yet. Or if they're there, they're just clumps of tissue. You go back even further, first trimester, you have tissues that at some point in time will become lungs, diaphragm, ribs, blah, blah, blah. So earlier in the point, the bigger the ripples, the greater, or I should say the worse the effect will be. With immunodeficient people, whether it's AIDS, chemo, radiation, or a genetic immunodeficiency, you'll see that Toxoplasma gondii can get in, bypass what little immune response could be there, and goes throughout the body, settles out in the meninges, crosses over into the central nervous system, and will be fatal. There's a good chance you've probably at some point in time have been exposed to Toxoplasma gondii. You've got a healthy immune system. Your immune system's going to remove it. You're going to get an infection. Since it's subacute, it's going to be hit, and within a few days, the height of symptoms, and a day or two later, it's cleared out. At worst, you probably had a sore throat. Maybe under your jaw, those lymph nodes kind of got a little swollen. Might have had a low-grade fever. All of these are things you could cross off because, I've got a sinus infection, my allergies have kicked in really hard, or I may have a slight cold, and in a few days, gone. But there are people, as I said in the last slide, there are people that this is going to hit hardest. Pregnant woman gets infected. The pregnant woman herself generally is not going to have much of a problem with it. Her immune system will be healthy. Her immune system will clear it out within a few days. No long-lasting effects. But pregnant woman gets infected, there's a 33% chance that this will cross the placenta. If it crosses the placenta, it becomes a congenital infection, well, then there's major issues. There will be major problems. As I said in the last slide, the point that the congenital infection occurs will have long-lasting effects. The earlier in gestation, the greater the effect will be, the more deadly the effect will be. Turns out Toxoplasma gondii is an obligate intracellular parasite. It does not like to be out in the environment. It cannot handle the environment. It wants to be inside. It wants to be inside one of our cells. This is the reason why they tell somebody who's going to be getting pregnant or is pregnant, if you've got cats, at least stop cleaning the litter box. At best, see if you could rehome the cat until the baby is born. Cats are a reservoir for this, okay? Cats go eat a mouse or whatever that has Toxoplasma in it. It is able to get through their gastrointestinal tract, gets in, infects, comes out. It's passed out in the feces, okay? Rodents or whatever eat cat feces because it's still high in protein and nutrients. They get infected, cats eat, and there's the great big circle of life. For us humans, if it's a domesticated cat, the cat goes into the litter box, defecates in the litter box. We clean the litter box. Here's the thing. The litter boxes cause lots of dust. If you smell feces, not only are you smelling the compounds, the aromatic compounds that are being given off, that are degrading and giving off, but in the dust, you're also smelling, breathing in particles of cat feces. On those particles of cat feces would be the cysts of Toxoplasma gondii. That's how it gets into you. That's how it gets into the pregnant women or the pregnant mom-to-be or the hopefully pregnant mom-to-be. Gets into them. We are a dead end, okay, because no cat's going to come and eat us, hopefully, and get infected. Well, gets into the mom, crosses the placenta, and then you have issues with fetal development. So when it comes down to it, we're exposed quite often. Okay, this is one of those you get exposed to quite often, especially if you have cats or there's cats in and around you. We can also find it in our undercooked meat. Okay, Toxoplasma gondii can be eaten by cattle. Cats or something that ate a rodent poop somewhere in grasses. Cows come along, eat. There you go. Now it's in them. It stays in them as a cyst. You come, you eat undercooked meat or raw meat, and it's now in you. So, best way to get rid of it? Freeze, -20. This is flash freezing, okay? This is a bit colder than you're going to find in your normal freezer at home. So this is going to be super cool. Things that are generally being transported around, stored long-term, meats, things like that.